number 2 speak to. And we are very lucky today to have 2 guest speakers from the National Adult Literacy Agency, Authority, what's the last name? Yeah?
Agency, yeah.
Agency. Yeah. So we have Fegrus, Dolan and Michael Duffy, and I'm going to let Fegrus and Michael introduce themselves. I wouldn't do it justice, but we had Fegrus speak to our dietitian students last year, and they got a huge amount out of it. So we invited Fegrus back to speak again to you this year. So last week, Fegrus, I covered a little bit on health literacy. So a little bit about literacy, but more about health literacy, and really trying to impart to the students the importance of, you know, rather than just giving a patient a resource, whether it's a written piece of information or, you know, providing them with a link to something, to really think about literacy levels of the patient sitting in front of them and how messages are portrayed. So I've covered some basics, but I think your talk, having looked at your slide, will really complement what I kind of spoke about last week. So I will hand over to Fegrus to talk to you, and then Michael's going to speak, and we'll have some questions as we go as well. So I'm facilitating that. So over to you, Fegrus.
Thanks very much, Audrey. You're all very welcome. We're delighted to be able to join you here. My name is Fegrus Dolan, and I work for NALA, that's the National Adult Literacy Agency. And Michael and I are going to present on literacy changes lives, health literacy. So I'll introduce you first to Michael Duffy. Michael was an adult literacy student with the Cavan Adult Literacy Service, and he's going to talk to you for 20 minutes or so about his learning journey and how literacy affected and then changed his life. So over to you, Michael. All the best.
Thank you, Fegrus, for that lovely introduction. Hi, everyone. As you obviously see on the screen, I'm a mature student, and quite mature actually at the moment. I started back, my journey to education is that I couldn't, up to the age of 57, I wasn't able to read. When I say I wasn't able to read, I was able to read my name and address and things like that, but to read a document fluently, that wasn't possible for me. I wasn't unable to do that. That may be a shock to your generation, but that's the way it was. And it wasn't until I joined, it got better. It actually happened by accident. I got a laptop as a present, and it sat in a room for nearly 2 years with dust and all kinds of things building up on it, until I was brave enough to venture into a class, and it was just for basic computer beginners, like, I mean, the very, very basic, push a lot of buttons and so on like that. But the problem with me was I didn't realize that in doing a course you had to prepare a portfolio, which you are quite aware of, and that involved reading, writing, and so on like that. And that's where my problem arose. I wasn't able to read the documents, like, you may connected with the course. And at that stage, I said, oh no, I'll give this up, say that not really suits me. But the tutor was a very observant lady, and she reckoned there was something amiss here. So she contacted the AOL in Cavan, Siobhan McEntee, and she arranged for a one-to-one tutor to help me out. That went on for about 6 to 9 months. And little by little, I got to know how to, like a child, like, I mean, how to break up words, how to do syllables and things like that. And I got quite good at that, if I'm not too arrogant to say that. And kept going on ahead, and I went into a class setting doing a level 3 communication course. I'll not forget, and that was tremendous. That was like going from infants to second level students nearly at the way I was moving, at the rate I was moving. But when I went into that class, I thought I was the only person, like, I mean, with literacy difficulties, the only fool that couldn't read a document or something like that. But when I went into that class, I realized I wasn't the only one. There was an awful lot of other ones there. And as well as that was an adult literacy class. But as well as that I was senior going into that class. But there was all different ages in that class. There was all different ages in that class, from my age to actually there was a girl and she was 25. You know, so therefore it's something that goes across. It goes across all kinds of. There's interference as well. It comes all age groups is affected. So it's not just the older age group. Every age group is affected, and it changes everyone's life. Like, I mean, how they progress and how they move on, things like that. I think they've lost me until now. And that's how it has changed my life. I like reading books now and stories and people and get to know people and things like that. In like celebrities, you hear about them, but you don't know anything about them until you actually read the book and so on like that. And that's really what changed my life. It gave me more confidence in doing. Say I read the newspaper like now, and I know what the doctor will say. So therefore, I can participate more in society and get involved more in society and have a conversation with other people in the group. Like, you know, something like you go into the pub for something like that. You can have an intelligent chat, things like that. So that's really where I am. So that's what I am at the moment with it. And it's good to be able to do things like that. You're able to participate in society more than if you couldn't. And that's really where it changed my life dramatically. I was very interested in dramatics, amateur dramatics, not the Olympic activities. And I worked backstage doing theatre work and putting up stage, putting up props and things like that. But I remember one day clearly, one of the guys that was over there said, "You should take a part in the production." That was grand. I said, "Oh God, that'd be lovely." So he handed me a script. I looked at the script and it looked to me, I wasn't able to read. It looked to me like it was wrote in Greek, and that was it. I just made the excuse. I know it doesn't suit me. I don't have to do that. I prefer to do what I wanted to do. That was something, and I went back home, and that gave me the hunger to learn, to be able to do that. Now I can. Someone hand me a script. I can read it. I can do the performance and things like that. Not great, but I can do it. And I can talk about it anyway. And I enjoy it, and it gives me more. I think it helps people. It helps me psychologically, as well as physically, as well as things like that. Because education is a big factor in people feeling well in themselves, and in feeling well in themselves. It's not just physical. It's not just psychological things. It's physical things. Because I work with a group that involved with depression, suicide awareness group, and I find that a lot of the grief that comes into us doesn't feel that it's fitting in society. And I think, like, I mean, if they're good at education, good at literacy, things like that, they can participate more. They can have an intelligent conversation with people and things like that. And that makes people feel good in themselves, makes them feel more part of society, if you want to say that kind of a thing. And that's how I got on. I mean, that's how I got on in life. And now I'm in a good spot. I'm in a good spot now, and I'm very happy in myself. Put it that way. And I think it's very, very important. The journey I have come, whereas I started out in later life, it's a massive journey. But before that, before I could learn how to read and write, I developed skills of my own to get over that. We say if you're going to tax your car or if you're going to do something like that, you go in and you say to the lady or the gent there, could you help me out here? Could you help me out here? And 99% of the time, yeah, the words, and you could bring home the form, or you could fill it in, or get someone to fill it in for you, and that kind of thing. That kind of thing that was a brilliant lifesaver. So in other words, I didn't have the skill to read or write, but I had the skill to judge and being able to do it. Now we'd say there's professors there in universities that can read beautifully, that can do things like that. I can't do that, but you can give me a table and I can sand it down, clean it, French polish, and bring it up like a sheet of glass. Can that professor do it? Maybe not. But I have that skill that I can do that. So that's really where I am at the moment. And that's really my story. I'll hand it back to Fegrus now, if that's okay, Fegrus.
Thanks, Michael.
Does that come through clear?
Yeah, that was clear. Audrey, could you hear everything clearly?
Yes, absolutely, Michael. Thanks very much for sharing your story. It was very insightful, and I think it really is good to hear from your perspective, what's important, how literacy is so important for everyday use and
I think education is very, very important.
Yeah. Can I ask you a question?
And that was across every. I just add one more bit, Fegrus, if that's okay.
Yeah.
Just one more thing, which I refer to me as a more senior person. I'm not use the word old, but senior person. Going back to education at 57. That's not just, we'd say, don't think that that's just a barrier at the age of 57 or 60 or 55 or whatever it is. That's in every age group. And that's happening even today. There's people slipping through the net, which shouldn't happen, but it is happening. And it's affecting them psychologically, as well as physically. So that's something I'd like to bring to bear. It's not just the older people, it's younger people. And use me as students, use me have grandparents, parents, whatever, things like that maybe slip through the net and maybe just develop the skills, judge and write that I developed and was too embarrassed to say anything about it, and maybe bear that in mind. So thank you, Fegrus. I'll sign off with that.
Thanks, Michael.
Thanks very much, Michael. That was really honest and frank, and it was lovely to hear, and it's great to see you doing so well, and how the education changed so much in your life. And just before I move on, Audrey, did I hear you say you had a question for Michael?
Yeah, I just have a quick question, Michael, just because obviously the students sitting here today are starting their journey to become dietitians, and hopefully in 2 years' time they will be dietitians that will be sitting in front of patients who might be sick, or patients who want to lose weight, or patients who have just been diagnosed with diabetes. And I'm just wondering, when you started out on your journey, or before you started out with, being able to read and write, how did you find going to a doctor, or going into a hospital setting, or going into, meeting somebody who is explaining maybe about your health, or giving you maybe a resource or an information sheet and telling you to follow? Was that difficult for you in terms of going to the doctor, or how did you manage that?
Right. I give you a couple of scenarios on that. We'd say you go to the pharmacist. I'll take the pharmacist first. Or we say we'd say, I'm not on them now, thank God, but I was a number of different pills, and you had to take one at 1 o'clock without food and something like that. And what I done was, you had a blue pill. You take the blue pill at 2 o'clock. You take the red pill at 4 o'clock, and some of this. And I get the pharmacist to explain that. So therefore, in doing that, I didn't have to look at the label on the bottle. That kind of a thing. And then also going to the doctor was a wee bit intimidating, because the doctor would say, come out with these, the way a doctor writes a prescription, and it's in another language. I couldn't expect to be reading the prescription. But we'd say the doctor will tell you a big pile of stuff, like, I mean, and when your head is at someplace else and you get a diagnosis or something like that, it's very hard to take it in. But I developed this skill as I went on to be able to say, hold back, could you just explain that again, run that by me again? As I went back to education, I got more confidence, as I said earlier, to ask the question of the doctor and things like that. So that's really why the way I done it. So then.
Good.
Okay.
Thanks for that. That's really
That okay, Audrey?
Yeah, absolutely. Yeah, that's really good. Thanks very much, Michael.
Okay, Audrey.
Thanks, Michael. Okay, I'll run through my presentation, and then at the end, if you have any questions for Michael or for me or for Audrey, shoot away. Okay, so yeah, I'm going to talk about literacy and what literacy is. So you've gathered a lot of this by listening to Michael, but literacy is much more than about reading and writing. It's about technology and about numbers and numeracy, and we're going to come to that in this presentation in relation to your work in the future. But it's also about self-confidence and self-esteem. Michael has the confidence now to stand up in front of a group of strangers and make this presentation, to do a webinar from his own home. That took a lot of confidence, you know, and that's something that Michael has developed as a result, I think, of going back to the Adult Literacy Centre and working on his reading and writing. Would that be right, Michael?
That would be absolutely right. Back a number of years ago, if you had said to me, I'm going to do a webinar with any group of people, including the people, students which we are talking to now, I'd have said, forget it. That's what I would have said. I wouldn't have been thinking of that. But it's education isn't something you go in and you just do it. It's little by little by little. It's baby steps. And if you take a step which is too big, it could scare you and you could have to go back. So take little steps, little steps. That's my advice. That's it. Okay, Fergus.
Thanks, Michael. So literacy is also dependent on the context. Michael said he could write his name and address and a few things, but he couldn't cope with, say, the instructions on the packet on the medication he got at the pharmacy. But some people, if they're using the literacy in a context they're very comfortable with, say, among their family or with something they're interested in, sport, or in Michael's case, French polishing furniture, they might be okay on that. But in a new context, like meeting a dietitian, they might completely blank and completely not understand anything. So just you need to be aware of that when you're working, that some people you meet may not understand the language you use when you're talking about diet and health. It may not be the language they use every day. But something to remember is, it's a quote from an American academic, one of the most famous academics on literacy, a guy called Thomas Sticht, and he said, a beginner reader is not a beginner thinker. So just want you to remember that when you're meeting people in your work in the future who may struggle with reading and writing. Think about Michael and think about obviously the brains that he has, but he just missed out on the education, and therefore his reading and writing wasn't so good until he went back to education. So bear that in mind. Okay. Oh sugar, my thing is frozen. Hold on one sec, I'll try and get this.
You okay, Fergus?
Yeah, I'll just have to go through it this way. Can you still see that slide, Audrey?
Can you see that?
Yeah.
Yeah, no, we can't. Yeah, that's fine.
Sorry, if I put it into PowerPoint mode, my screen freezes. So I'm going to have to use it in this mode here. So what is health literacy and health numeracy? So health literacy and health numeracy have two elements. You, the health service, communicate clearly and take account of the possible health literacy and numeracy needs. The people you're talking to, they understand the information clearly and they take it on board. So it's about mutual understanding. It's no good if you just go in and talk at somebody and you're talking about diabetes or their diet or something, and they don't understand the terminology and what you're saying. For proper health literacy, they need to understand and be informed about what you're saying to them. So it's about mutual understanding, okay? So in that image, the doctor saying your treatment is, and the patient saying, I can't believe I have. She has understood, okay? So also be aware that when you're talking to somebody about, say you're telling them they need to radically change their diet or they have diabetes and here's what they need to do, this could be a massive shock to them. So they might be in shock and traumatized. So it's difficult for them to go, oh yeah, that's fine. And you're then throwing other information. You need to test your bloods and monitor your sugar levels and change your diet. It might be difficult for them to take that in. So, you know, maybe you need to gauge each meeting or each patient and progress slowly and kind of check in with them to see, do you think they're understanding what you're saying and that they're able to move on and take in what you're telling them? So if you tell them they've got diabetes and they need to, for example, monitor their bloods and all, they might just be in shock at hearing that news and they might not be able to take in anything else you're saying. So try and be aware of that, okay? Slides still okay there, Audrey? Can you see those?
Yeah, we can.
Okay, thanks.
Yeah,
so what is health numeracy? So numeracy is kind of what we call maths in the everyday. So the maths you learn in school, how to translate into life, shape, pattern, number, relationship, all that thing. So health numeracy is the ability to understand and use quantitative health information, including basic calculations, information in documents, and non-text formats such as graph, okay? Research shows that many people do not have adequate numeracy skills to look after their health. And we'll come to that later, what percentage of Irish people have strong numeracy skills or not. By numeracy skills, I mean math skills, okay? They also found that those with poor numeracy skills were less likely to take a bowel cancer screening test. So that might be something that's offered to people over a certain age. But if you have poor literacy and numeracy skills, research has found that you're less likely to take up that screening, okay? Cancer Research UK recently found that 46%, so almost half of people got an answer wrong to a question when they were asked whether a risk of 1 in 100, 1 in 10, or 1 in 1,000 resulted in more chance of getting a disease. So almost 50% of people didn't understand that. So you have to understand that the people you'll be dealing with in work will not understand a lot of the things that you're chatting to colleagues every day, and it's just the normal lingo and language you use in work. But a lot of people you're dealing with won't understand it. That's new language to them, and they're in a new context, a new situation, and they're just not taking it on. Michael, even when he had literacy difficulties, had the confidence to say to the pharmacist, I didn't understand all that. Can you please explain what pills I have to take at what days and what time? He had that confidence. A lot of other people with literacy or numeracy difficulties would not have that confidence. They just say to you, yes, no, yes, yes, yeah, that's fine. And they walk out of that meeting with you not having understood what you said, and therefore taking their medication incorrectly, monitoring their bloods incorrectly, not monitoring their sugar levels, not changing their diet, because you've just blah, 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 spoken to them, at them, and they haven't taken it on board. So your job is not to speak at them, but to be sure they've understood it, taken it on board, and will make changes. So it's a lot more complicated, your job, than just explaining it and blabbing on like if you're talking to a colleague who understands all that language. Okay? Okay. Causes of unmet literacy needs is a nice way of saying literacy difficulties, literacy issues. So some of us, you're in this course here in UL, your literacy needs were probably met at primary school and at secondary school. You probably did the Leaving Certificate and got high points to get into this course. Other people, their literacy needs, like Michael, until he was 57, were not met. And there's a range of reasons why literacy needs were not met. It could be physical reasons at home, psychological. It could be educational needs, maybe big classes, streaming, no strong educational support, not good educational supports at home. It could be social and economic needs. It could be family needs. It could be changing literacies, i.e. you think of maybe parents at home or grandparents or uncles and aunts, the change in literacies might be technology. So you might have an uncle, aunt or a grandparent who doesn't have an online banking account and can't pay their car tax online and can't book a Ryanair flight. Not that they are at the minute, but last year they couldn't book a Ryanair flight. So you may know someone, and you may know someone, and you mightn't have realised that they couldn't do these things, that they don't have an online account. And when you don't have an online bank account, it's difficult today to get your banking done because banks are open less and less hours. There's less and less people in them, and in a lot of small towns and villages, they've closed the banks. So literacies are changing all the time. Dealing with revenue commissioners, dealing with car insurance, dealing with so much stuff. It's all online now. It's so much more difficult to do it in the older way, where you got help, like Michael explained, with the doctor or in the bank, where you got help from someone who was helpful. A lot of people now are told, no, we're doing it all through online, and that just doesn't suit people. Okay, so be aware of that. If a colleague in the place you work says, well, should we do all their testing of bloods online and let them type in their numbers online or whatever it is, it's up to you, who now knows about literacy and is literacy aware, to say to someone, yes, but a lot of our patients or service users will not have the literacy skills to do it this way. So I know it'll suit us and it'll save us time, but it mightn't suit them and won't suit them time, won't suit them. Okay, so the local adult literacy service. Michael said that he went to his local ALO. An ALO is an adult literacy organizer. So an ALO is the man or woman who manages the adult literacy service. So Michael went to Siobhan McEntee, who's the ALO in Cavan town, and he said, listen, I need help with my reading and writing, and Siobhan organised classes. So in every reasonable sized town in Ireland, there's an adult literacy service, and it's run by the ETB, excuse me. ETB is Education and Training Board. It was the VEC. Maybe when you were a kid, you remember the VEC school or the VEC office. Now they're called ETB. So in the ETBs, you can go in, you can get help. Every adult can do it. It's free and it's confidential. They're small groups, so they can be one-to-one and delivered through trained tutors. Okay, so it's available in every county in Ireland. So just ask where your local ETB adult literacy service is, so that if you come across someone in your work who you're dealing with and you think, I think this person might have a literacy issue, or you even ask them, do you need help with your reading and writing? And they might say yes, and you might be the first person that they've admitted to that they've got a problem with reading and writing. So then you can give them a good referral by telling them about the local adult literacy service in their town that's free, it's confidential, and it's very unlike school. Most adults who had a literacy difficulty didn't like school and hadn't a positive time there, I would say. Okay, so the next slide there is about, this is kind of finding out. This was OECD did surveys to find out about the literacy levels of Irish people. They did these in countries all over Europe and the world. And so this would be a typical question at level 1. How much sugar is in the pot? So you there watching in the University of Limerick have good reading and writing. So you would scan. You quickly look through and you come down to near the bottom and you see the word sugars 1 gram. So you'd write sugar 1 gram. So that might take you 5 seconds, 10 seconds, 30 seconds, because you're used to scanning and you look through and you come down to the word sugar and you write 1G, and you know 1G is 1 gram and you write 1 gram. I want you to guess now if you can't get that right, that's a typical question at level 1. If you can't get that right, you're at level 1, okay? So what percentage of Irish adults do you think are at level 1? So what percentage of Irish adults can't quickly read through that and see sugar 1 gram and write down 1 gram? So normally if I'm in the room with you, I'd get you to show a hand or shout up some answers. Can't really do that too well here. So there's the answer. The answer is 18%. 18%, almost 20% of Irish adults are at level 1. They're at or below level 1. That's over 500,000 Irish adults, okay? And 25% of Irish adults are at or below level 1 on a basic numeracy task. So 750,000 Irish adults are at level 1 on numeracy. So that's a basic numeracy task. So if you look at the first little graph there, the lady holding up the books, Ireland is 17th place in literacy and 18th in numeracy out of 24 countries. So that they're poor countries. They're poor figures for Ireland. So when you hear Irish people saying, "Oh, we've got one of the best education systems in the world," think again. Maybe we don't. Maybe we just heard that trotted out year after year and kind of believed it. And maybe it suited you and it suited me, the education system, and it might have suited Audrey, but it doesn't suit everybody. It doesn't suit the 18% of Irish adults who are at level 1 of literacy and the 25% who are at level 1 of numeracy. So just bear that in mind. Here's some health literacy stats. These are stats from a few years ago, EU Health Literacy Survey. Ireland's down there, the 6th one. IE is Ireland. So 10% of Irish adults are at the very lowest level, and that's inadequate health literacy. And 30% of Irish adults have problematic health literacy. So in total, 40% of Irish adults have limited health literacy. 40%. So when you're out working, think of the people you deal with in your work. 40% of the adults you deal with will have limited health literacy. So bear that in mind when you're working. Okay. Next slide. Why is it important? It's because people with limited literacy and numeracy skills have poor overall health, are less likely to make use of screening. They're less likely to turn up for screening for bowel, breast cancer, whatever the screening is available. They're less likely to go because they're nervous that their literacy issues will be uncovered, and maybe they haven't heard about the screening and it is free and you should go once a year, once every 2 years, or whatever it is. They present in later stages of disease. So they're just, maybe for a range of reasons, they just think, "Oh, it's fine, it's a pain, it'll go away." They're less aware of what their pain may be, and so they present later. They're more likely to be hospitalized because they presented later. They have poor understanding of the treatment. So you need to bear that in mind when you're explaining the treatment. And they've lower adherence to a medical regime. That's up to you too. You need to explain more clearly and make sure they've understood what the medical regime is in whatever it is, be it changing their diet, or be it diabetes and testing and monitoring your bloods, etc. Okay. Okay, it's important because 1 in 5 Irish people are not fully confident that they understand the information they receive from a healthcare professional. You, hopefully in 2 or 3 years, will be working as a healthcare professional. So 1 in 5 Irish adults are not confident that they fully understand what you're telling them. Okay? 43% of people would only sometimes ask a healthcare professional to clarify information if they didn't understand something that the person had said. So that's you. So 43% of the people you talk to would sometimes ask you, your healthcare professional, to clarify something. So a lot of people would be afraid to, they'd be too embarrassed to ask you, "Please, could you clarify that?" Michael used to clarify it with the pharmacist, but he was an exception. Michael has confidence and he was an exception. 66% of people have difficulty understanding signs and directions in Irish hospitals. It's nuts that they're still written in Latin and all that, and they're very medical, jargonistic terms. A lot of people just don't understand them. If they don't work in or live in a hospital or work as a healthcare professional, they don't understand those terms. 17% of people have taken the wrong dose of medicine at least once. Okay? So, and recent research has found that 39% of Irish people are calling for less medical jargon. So when you're working with colleagues, when you're doing this course, you'll come across a lot of medical jargon, and that's fine. When you're talking to your classmates about it, it's fine to use that medical jargon. When you're talking to Audrey or the other lecturers, it's fine to use that medical jargon. When you're writing your exams, it's fine. When you're working with colleagues, when you leave college and you're working, it's fine to use that medical jargon with colleagues. But it's not fine to use it when you're talking to the patients, because 39% of Irish people call for less medical jargon. A lot of them don't understand it. We're all guilty of using jargon. I work in the adult literacy sector. I use jargon in the adult literacy sector. I'm guilty. When I'm talking to colleagues, I use it, but I have to try and not use it when I'm talking to you, because you don't work in the adult literacy sector. Okay? People aged 15 to 34 were least likely to ask a doctor, nurse, or pharmacist to explain things they didn't understand. So in your age group and up to 34, They're least likely to ask. They're just too embarrassed. Once again, I'm going back to the example of Michael asking the pharmacist. Maybe Audrey asked him later, did he ask a pharmacist or a doctor when he was in his 20s or whatever? I don't know. 45% couldn't define the term prognosis. So there's a word prognosis that every healthcare professional uses every day. And almost 50% of the population couldn't define it. They don't know, they didn't really know what the word prognosis meant. That's stark. You have to stop using medical jargon, I'll call it. And I know prognosis is not exactly medical jargon, but it sort of is. Because it's not a word that I use. I'm not a medic. I don't use it every day when I'm talking to my kids or my family or my friends. Okay? Embarrassment was ranked as the main reason for not seeking more information from a healthcare professional. 24% said embarrassment. Okay? Okay, becoming literacy friendly. A literacy friendly service takes account of the literacy and numeracy needs of its customers. By customers, I mean clients, service users, patients in your term maybe. So you need to look at the environment, the notice boards, the doors, signs, staff awareness. You're going to be aware now after this, after working with Audrey for a year or two. Audrey will come back to this again. So you'll be aware. But it's not much good if you don't tell your colleagues and wherever you work. Well, do you know that 18% of Irish adults are at lowest level of level 1 of literacy and won't understand what we're saying? So it's up to you to spread the word among colleagues when you get a job. Okay, you need to look at your printed material and your websites. Are they literacy friendly? Maybe not. And if they're not, then they're no good. Scrap them and get rid of them. You need to say to, I know it's difficult when you're new, but you need to say to a boss, listen, our website is not literacy friendly. Most people will not understand it. The printed information we give out on being diabetic or testing your blood or testing your sugars or changing your diet, it has to be in plain English or forget it. Just scrap it and redo it. Okay, verbal communication, the way you talk to patients and clients, it has to be in plain English. Okay, I'm going a bit behind, so I'm going to hurry on a bit. So the benefits of becoming literacy friendly is a clear understanding for patients. It's more effective communication from you, greater participation from patients, better and equal access, and better impact. Okay, I won't go through that. It's kind of like the last one. It's about you being literacy friendly and your colleagues being literacy friendly. So maybe I'll email this presentation on to Audrey, and Audrey can pass it on. You can read it again. Okay, I'll go on to the next one. Look at possible signs of a literacy need. So someone asking you something that's already displayed in writing. Someone unwilling to approach the front desk. Someone confused about their illness, how many tablets they take, and describing the medication by colour only. Not attending meetings or doing medicine reviews. Okay, not coming for refill, having too many tablets left, uneasy body language, giving excuses to avoid reading, say stuff like my wife looks after that. You know, these are the kind of signs that you need to look out for when dealing with a patient of yours. So maybe you could respond by explaining information more clearly, using a bit of the language they're using a bit of the language of plain English, not using medical jargon. Note down to other staff that you think this patient might have literacy difficulties. So give a tip off to your colleagues. Offer to help fill in the form, but without signing it. Include maybe family members in the discussion, if appropriate. Okay, assisting in ways to help, such as setting up pill boxes, using picture symbols, using blister packs for pills. Okay, there are a lot of ways you can help. Okay, in plain English, do not use all capitals. People find it difficult. Use lowercase, it's easier to read. You see the second half of this sentence. Line spacing 1.5 or bigger. Keep sentences to an average of 15 or 20 words. If the sentence goes beyond 20 words, I guarantee you can put a full stop halfway through and make 2 sentences, and do that. A line to the left. For emphasis, don't use italics or underline, use bold. Okay? Sans serif fonts such as Arial, don't use Times New Roman. Things like Arial are just easier to read for people with poor literacy skills. Font size 12 ideally, 11 if you have to fit stuff in, but if you want to fit stuff in on 1 page, that's not a good sign. Spread it out and put it over 2 pages. Define acronyms. What is NALA? What is the IPHA? You know, that's kind of jargon for someone who's not working in your area. We advise you use the active voice, not passive. Okay, take this tablet once a day, not that tablet should be taken. Okay. Okay, just watching your language. Don't use the word administer. Instead, say give. Don't use the word benign. Say harmless. Don't use the word dosage. Say how to take. Don't use the word hypertension. Say high blood pressure. Don't use the word malignant. Say harmful. These are just words that you'd use in the medical world, but people who are not in the medical world might not understand. Okay. Okay, tips for practitioners. So this is a little bit repetitive, but anyway, it's just they're just in one little chart here. Communicate using plain English and follow design standards. Give clear, easy to follow verbal information. Explain medical terminology. The layout and signage is clear and easy to follow. Think of your office where you're working, your workplace. All staff are aware of literacy and numeracy issues and how to respond appropriately and sensitively. So that's you and your colleagues. Even if you're young and new, it's good that you explain to your colleagues about literacy. They may know. If they know, fine, great. Check that people understand what you've said. So that's when you're dealing with patients, okay? Ask people to repeat what you've said. Okay, that's it. There's further information from me. As I said, I'll email this presentation on to Audrey, and if you have further questions, you can email me. So now, Audrey, if you want to open it up, and we bring Michael back in again, and just let us know if anyone, any of the students or you have any questions.
Thank you very much, Fergus and Michael. I think that's really helpful, and I love the way, Fergus, you've made the presentation very much aligned with health professionals, with medical or health literacy. So I really appreciate you taking the time to do that. I'll go to the students first. If you have any questions for Michael or Fergus, really good opportunity now to ask any questions to the experts on adult literacy. No? No, I think Fergus, you've explained it quite well in terms of, I think it's really important for our students to know that you're right, that they could be the first person that somebody discloses that they have literacy difficulties and what to do with that information. I think that's really, if nothing else comes out today for that's really important, that they know where to signpost or where to refer that person onto. And also, I think, Michael, what you said as well about, looking for the signs, like Fergus said in his slide, looking for those signs that somebody might have some difficulties. And especially if you're, our students, when they are dietitians, will have to explain to somebody what diabetes is and how to control or how to, if somebody has a low blood sugar, how to treat, a low blood sugar. And it's really important that information is given in a way that it's really understood. So, looking for the signs that somebody might not be, taking that information in and explaining in a really layman's term, how to treat, for example, how to treat blood sugar, a low blood sugar. And I don't know, Michael, did you find it helpful for people to check back with you? So if they were explaining about a condition, to ask you to kind of teach them back about what the condition was, or in fact condescending. I suppose it's a balance here about how to check back in that the person understands it versus being condescending or being talking down to the person. Like how do you balance that, I suppose, Fergus? You'd be based or even, you know what I mean? Like how do you balance making sure the person understood versus being aware that you're not kind of, making them feel bad or that you're not speaking down to them?
Sorry, was that a question for me? Or I didn't hear everything crystal clear.
Either, so yeah.
Well, I can go first on that one, Michael, and you can add on to it. I suppose, yeah, you just have to use your intuition in, the way you've explained it, even Audrey, suggests that you've got it, so that you kind of say, so you've got diabetes. This means, you want to ask me any questions about that? Did you get that? And you kind of feel your way around and see, do you think they've got it? Have they asked questions? Can you, and maybe you might feel it appropriate for ask them to explain what you've said back to you to be sure. I don't know, Michael, have you any further comment on that?
Well, what I'd say is that the medical professions now, if you go in and you have a medical complaint such as diabetes, the jargon they'll do it, and they'll hang you a leaflet explaining it. I don't think that's good enough to hang you a leaflet explaining it, because you could come back into the literacy problems again. So if you had a sort of a leaflet explaining it, as well as some physically explaining it, but more done out in graphs and in diagrams, like little, we say, showing the sugar, like a little drawing, we say, showing the person taking the sugar, like the person not taking the sugar, and the differ in the person, like illustrations, little illustrations, things like that. But I think it's very important to engage with the patient, with the person, with any medical problem at all. I think it's very important to engage with the person, because maybe the medical problem they have could be resulting in something psychological, could be resulting in maybe a literacy problem, things like that, because the literacy and physical ailments such as diabetes, heart disease, and such things like this, they're all linked up. We're all linked up together. So maybe we shouldn't be just looking at, well, it's A, B, C. It could, what caused A? Was it coming from something else? Was it coming from something else? Maybe look a little bit deeper. That just talk a little bit about the history of the person, find out things like that. That's been my freedom.
Great. Thanks very much. That does answer my question. And I suppose another question would be, a lot of young people now have smartphones, have the iPhones or have the Samsungs, and is pointing somebody to a link, whether it's an Instagram post or, a Facebook page, is that being taken up a lot more in terms of, younger generation with literacy difficulty? Or how is that kind of navigated? Like, how, should you be promoting the use of links and apps and posts, or not?
I'm not sure, Audrey, is the answer. My feeling is that it could be useful, yeah, especially if there are videos explaining things. And so my feeling is yes, but I haven't got expertise on this.
I suppose it's to be aware that the link that you're showing them is a trusted source. That's
yes. Exactly. If you, as a dietitian, look at the link and look at the video or whatever the information, you think, yeah, that's accurate and it's well explained, yes, yeah, by all means. Okay. Yeah. But if it's from Fox News,
Yeah.
Yeah, forget it.
Yeah. Very good. Any questions from anybody here? No? Everything is clear? Yeah. Good. Well, Fergus, thanks very much, and Michael, we'll let you go. Thanks, Fergus, for the slides, and yeah, if you can send them on, please send them on. So that's fine. I can put them up, and yeah, the recording as well. And Michael, thanks very much for taking the time to speak to us today. Very valuable. And I have another 10 weeks of teaching, so we'll definitely use a lot of what you said, as examples throughout the next couple of weeks when we're talking about, how to communicate correctly or effectively with patients. So I really thank you for that. And thanks again, for much appreciated.
Yeah.
Okay.
Thank you.
Thanks, Michael, and thanks, Audrey. Thanks, everybody.
Thank you, Audrey. Thank you.
Bye-bye.
Bye-bye. Bye-bye.
Bye.
Bye-bye.